When it comes to fillers, is a different story. The idea of fillers is to add volume. So as we age, and finally we're able to understand that, as we age, the volume on the face starts to shrink. We have less volume on our face. And that is because, first, of some skin laxity, so there's some movement. The volume that was there starts to go immediately. The fat that we have under your skin and close to the bone also suffers some atrophy, so it shrinks. And at the same time, you suffer what we call some bone atrophy. We start losing bone. So, and the bone is the foundation of all the face. So what happened with that is the face starts to shrink a little bit. And because the skin doesn't tight over that, you start to have more laxity, and at the same time, the volume starts to go down. So what the fillers do is they replace that volume that was lost. So that was why we start using fillers at the beginning, just for reversing or fighting the signs of aging. And that it's very common under the eyes, over the cheekbones, on these folds, on this down here, on the jawline, on the temporal bone. If you are from Asian descendants and the Far East, it's very common to do in the forehead, and you can extend it to the nose, and now very commonly to the chin. So what initially was something that we start doing just for fighting age, and also we understood that also you can use it to change some of the appearance of people. So someone is like, let's say, reach through the chin and wants to get a bit more of projection and definition on the jawline, and is young, it's not a problem of aging, it's a problem of anatomy, we can also do that to reverse, to change those signs. So get the more definition on the jawline, the better definition on the chin. The same thing for the lips, because some people, because as we age, the lips get thinner and they go inverted. By doing some lip fillers, we just bring them out and get more plumpy. Okay, but also young people, that is not a sign of aging, it's that they have thin lips. We can also have that to get a different look. So balancing all these things and combining fillers and Botox, we can really work with that. And it is probably the most powerful combination I have in our field, non-surgical, to get things going. Also, there was a moment someone asking me, so if you start all this, when I start, a long time ago, when I start using Botox and fillers, so, but you are losing surgery. No, I'm not losing surgery. Actually, I'm getting patients, because there was a moment where the only alternatives we had was surgical. And so what happened is that there was a very big group of people that were not for surgery, and they're already showing some signs of aging, but it was not enough for taking them to the operating theater. So what happened is those people that was in those groups were actually able to come to the treatments like Botox, fillers, and also the skin boosters that we're going to talk about later. And that really helped with that. So what happened is the big chunk of patients that we had for not doing anything, just reduce it, are very, very early ages. And then you have patients for aesthetic medicine, that's what we call the non-invasive, and then you have the patients that come for surgery. And actually with that to get better results. And you can combine even those. So surgery and non-surgical treatments don't exclude themselves, because sometimes someone comes for a facelift because they have indication for a facelift, but they want to keep the result of the facelift, and they use Botox and use neurotoxins, etc. Just as a disclaimer, we use the word Botox. Botox is actually a brand, but it's like Coca-Cola and Pepsi. You know, everybody calls it Coca-Cola. So the Botox goes in the same way. But there are essentially in the market 3 different brands of neurotoxin, which is Botox, Dysport, and Xeomin. All of them work in the same way, and they are interchangeable more or less. So it's not a matter of branding. A lot of people ask me if you are using the American Botox. Well, Botox is American. The other 2 are from Europe.